Literally in one day, our lives were turned upside down.
You know, whether it be a cardiac cripple or a stroke cripple, no one wants to be a cripple.
I had had my open heart surgery in April, and in September, 2 of the bypasses were plugged.
I'd apparently initially failed a test that they had given me. It was a nuclear stress test, and they believed that I had some major arterial blockage leading into my heart.
It can happen to anybody at any time.
The prevalence of cardiovascular disease in the United States is getting more serious every day. Heart attacks occur every 30 seconds, making them the #1 cause of death. Strokes occur every 45 seconds, making them the 3rd leading cause of death. Combined, cardiovascular disease accounts for greater than 1/3 of all deaths in the United States. Along with this, diabetes is now affecting 50 million Americans. The risk of dying within 1 year after having a heart attack is now 24% for men, 42% for women, and up to 50% of all heart attack deaths are sudden and unexpected. 65% of women had no indication or symptoms prior to having a heart attack.
My cardiologist in Billings, Montana, he told me after putting stents in my heart that I would be okay for 3 to 5 months. And he said, don't expect a major cardiac event in 3 to 5 months. I took that as essentially a sentence. I had 3 to 5 months to live.
I was absolutely scared to death because I could feel something tingling in my head, the backside of my head, and it started tingling down my left shoulder, my arm, my leg, tingling the entire left side. Being a man, my first initial reaction was, oh, dadgummit, I've got some flu or cold. But when it went to my fingers and when it went to my toes and the water turned hot on my body, I'm like, this is not good stuff here. I've got to get out of the shower now.
There is a good reason why this heart attack clinic was formed. These alarming statistics don't have to continue.
We can find out who's at risk prior to an event. We can find out if they have disease, why they have the disease. We can put treatment to that, and we're showing if you do that, you can literally get rid of the disease.
The overall program focuses on learning how to identify what causes disease. And so learning how to identify that and then learning the treatments for the individual problems, that's where we can get somewhere. What we need to do is get to optimal care, and that includes the Bale Doneen Method to really drive heart attack risk down and actually treat these people.
The Bale Doneen Method results have clearly demonstrated that heart attacks and strokes are preventable, and that this disease is not only treatable, but reversible.
Well, Brad's one of the first people really to prove, in fact, that you could reverse this process. I mean, we really didn't think once you had the lesions that you could ever change that. You might hold them static, but you couldn't ever reduce their severity. And that's what's really so exciting about this, I think. And he has proven that without any question.
Yeah, we've been real pleased with our results over the last 11 years. We haven't had anybody that we're treating die from a heart attack or a stroke. We've only had one patient on treatment actually have a heart attack in the last 11 years. And we have historical data that would tell us we should have had hundreds of patients have heart attacks and strokes, and somewhere around 20 to 40 deaths over the last 11 years, and we haven't.
The Bale Doneen Method was born out of 20+ years in family practice and the observance of too many patients suffering heart attacks and strokes. The Bale Doneen Method began as a targeted quest to learn how to detect people at risk and treat them effectively. To Dr. Bale and Amy Doneen, it became obvious that the medical standard of care was not adequate in this area of medicine. Blood pressure and cholesterol standards were accepted way too high, while good cholesterol was way too low.
We tell our patients when they come in our clinic, they have to understand they will not be treated to the standard of care because that can get them killed. That's what I was doing for the first 20 years of my practice. And a lot of my patients were having heart attacks and strokes, and some of them, unfortunately, dying from heart attacks and strokes. I stopped practicing the standard of care and going for optimal care in these patients 11 years ago, and that's drastically changed the number of people having events and dying.
The incidence of heart attacks really has not come down. The survival rate has gone up because we have excellent surgeons and excellent modes to open vessels, but the detection process has been poor, and the standard of care really doesn't pick those people out who may be at risk and don't know it.
Another serious problem was that the commonly performed treadmill test was missing too many people at risk, and EKGs did not always show pending problems.
That is the whole bottom line of this. Having patients that he's referred to cardiologists and so on, who have been given a clean bill of health, and a month later they have a heart attack. Now, do the treadmills and the standard cholesterol analysis and so on, it's obviously not good enough.
So I made a trip to Spokane about a year and a half ago and went through his clinic and program myself. And in the course of that evaluation there, he discovered some disease in my arteries and other abnormalities that hadn't been previously recognized.
Because of this, Dr. Bale started using other tests to assess structural disease risk. The Bale Doneen Method incorporates numerous structural tests, such as EBCT, CIMT, 64-slice CT, and echocardiograms to identify patients at risk. This approach helped ensure at-risk patients were properly identified. A series of blood tests were adopted to identify gene types, particles in blood, and other concerns such as fat triglycerides and insulin levels. Genetic testing was employed to identify patients with a predisposition toward developing disease. Even lifestyle, diet were all considered as a critical part of the patient profile.
So these extra, more in-depth, advanced blood tests, if you will, help us greatly in identifying patients at risk to go on to diabetes, and somebody that we find cholesterol buildup in the wall of their artery. These tests help tell us exactly why is that cholesterol building up, and then we know what to do about it.
I started out with cholesterol levels at 300 and something and triglycerides at 400, and they've come down. I think right now my cholesterol is at 164.
Today's standard of diagnosis is based on symptoms that can be identified and what caregivers believe to be the best achievable level of therapy and treatment.
The thing that they also found out was that I was insulin resistant, that no blood work previously had shown any indication, and he said it would probably have been 10 years before anyone had realized that I was insulin resistant, and by then I could have been diabetic.
Then it wasn't until I met Dr. Bale and he decided just for fun to run me through that little scan on my carotid artery, and it's like, Houston, we have a problem, and there's already some thickening of my artery that is cause for real concern, placing me at high risk for stroke and heart disease.
The goals of treatment in the Bale Doneen Method is based on evidence. Comprehensive, accurate evidence means an optimal level of therapy can be achieved and custom-tailored to each individual. The Bale Doneen Method has demonstrated over and over again that these superior goals are achievable.
Well, they told me the first IMT scan that I had, at that point in time, the plaque buildup in my carotid arteries indicated that my arteries had an age of about 65. And the good news that I received today is that one of those plaque deposits has completely disappeared, not even there anymore. And the age of my arteries now, the carotid arteries, about 55.
My vein age, if I recall, was 80-some years old. Now listen to what I'm going to tell you. Just got my results here a few days ago, my latest ones. 48-year-old vein age. And I'll be 61 here in not too long, this year.
Well, I had my tests repeated just recently, and there had actually been regression, significant regression in the amount of disease in my arteries, attributable to the changes and recommendations he made a year and a half ago.
Event reality is a term doctors use to describe what actually causes a heart attack. Each patient needs to understand this to fully appreciate the value of the testing that will be given to assess the risk. Up to 86% of all heart attacks arise from small, non-obstructing cholesterol lesions in the wall of the artery, also termed plaque. As much as 99% of all plaque is growing in the wall of the artery rather than the opening or lumen of the artery. In order to fail a stress treadmill test, there has to be an obstructing disease such as a blood clot to identify. But the majority of disease does not block blood flow in the vessel until a rupture occurs and a clot-related blockage occurs. This is why many serious cases are overlooked in the treadmill test. Here's an example of someone who died from a heart attack. This clearly demonstrates why many people who have had a normal treadmill can suffer a heart attack or stroke. There still are many good reasons to get a treadmill test, but obviously it can miss many people that are at risk. Event reality clearly illustrates why it is so difficult to determine who is at risk, even for those who have already suffered a heart attack or stroke.
The disease is not in the hole where the blood flows. The disease is in the wall of the artery. So when somebody has a heart attack or stroke, we know at least 86% of those, the blockage in the flow of blood is due to a blood clot that forms when the surface over the top of that cholesterol buildup breaks. The body responds by forming a clot. And within seconds, that clot can get big enough that no blood can go around it. And if that happens, you're having a major heart attack.
I was absolutely scared to death because I could feel something tingling in my head, the backside of my head, but I knew that what was happening was not good. Once I got into my trusty Land Cruiser and started driving toward the hospital, and once I opened the door, I fell straight to the ground, reached up and said, "Someone help me," and the next thing I remember was a very efficient doctor saying, "This man is suffering a stroke," and that's where we went from there.
The first thing was just making sure that Ron was going to live through this, because the first week it was so touch and go, and he was really having a lot of swelling on the brain, and it was just a very much a wait and see process. And then what we learned is recovery is also a wait and see process, because once we got into week 2 and week 3, it was like, well, he could be in a nursing home for an untold amount of time. He will likely be in a wheelchair the rest of his life. And these were the kinds of things that I was trying to prepare for and prepare our children for.
Most people never even have a thought that they are at risk, because sometimes even people who are the picture of health and exercise regularly can be at risk.
It was about a month later to go back into Dr. Bale's office to have the report given to you as to what the findings are. I was sitting there in the doctor's office looking around at all these other people waiting there. Just by looking at them, I could tell they're not fit. I am. I don't belong here. So I went in to have my evaluation, and I told that to Amy. I said, "Amy, I was apologizing. I really, I apologize. I hope I didn't waste your time. I know I don't need to be here." And she said, "Oh, yes, you do. You need to be here." It really got my attention. My IMT showed that my arterial age was 77 or 78. That got my attention.